Hello, everyone, and welcome to MediByte. Today, we're diving into something many of us have experienced, but maybe don't fully understand: streptococcal infections.
You know that feeling, right? You wake up with a sudden, super painful sore throat, and you start to wonder, is this just a cold or something more? Well, today, we're going to get to the bottom of it, because sometimes those very common symptoms can point directly to a strep infection.
So, first things first, let's break down what we're actually dealing with here. What exactly is Streptococcus?
It's easy to hear the word strep and think it's just one single bad guy, but it's actually a whole family of bacteria. You know, a lot of these species live on our bodies completely harmlessly. And get this, some people can even carry the types that cause infections without ever getting sick themselves. We call them carriers.
Okay, so to make sense of all the different illnesses strep can cause, scientists have sorted them into groups. Let's meet the main culprits that are most likely to cause us trouble.
Wow, look at that. You can really see how diverse these bacteria are. Group A? Well, that's the famous one. It's the cause of strep throat, of course, but it's also behind skin infections like impetigo. Group B is a really big concern for newborns and also for adults with underlying conditions like diabetes. And the Verdens group? Believe it or not, it's a common resident in our mouths and a primary cause of dental cavities.
Understanding the different types is one thing, but how do you even get it in the first place? Let's talk about how it gets around.
For Group A strep, the one that causes strep throat, it pretty much spreads just like a cold. We're talking about tiny droplets from coughs and sneezes. It absolutely loves crowded places like schools or dorms. But here's a really crucial piece of good news. Once someone starts taking antibiotics, they usually stop being contagious after just 24 hours. The other groups have different ways of getting around. Group B can be passed from a mother to her baby during childbirth, which is exactly why pregnant women are often screened for it. And that viridin strep that's in our mouths, sometimes it can find its way into the bloodstream where it can cause some pretty serious problems, like heart valve infections.
All right, now for the part we all really need to know: how to actually spot a potential strep infection. Recognizing the symptoms is your absolute first line of defense.
When strep infects the skin, the signs are usually right there for you to see. Cellulitis causes a painful, red, swollen area. Impetigo is really known for its sores that have this kind of honey-colored crust. And in very, very rare cases, it can cause necrotizing fasciitis. That's a rapidly spreading infection that is a true medical emergency with sudden, severe symptoms. Okay, this right here is a really key distinction. How can you tell if you've got strep throat or just a regular viral sore throat? Well, funny enough, the most important clue is often about what's missing. A sudden, really severe sore throat with a fever, but without cold symptoms like a cough, a runny nose, or red eyes, that is a major, major red flag for strep.
And sometimes a strep throat infection can lead to something called scarlet fever, which is most common in kids. The two big telltale signs are a unique rash that literally feels like sandpaper and the tongue that gets all bright red and bumpy. People often call it a strawberry tongue.
So, you think it might be strep. What happens next? Let's walk through what you can expect when you go for a proper diagnosis and what the standard treatment looks like.
This is so important. This is why you should never ever try to self-diagnose strep throat. Even for a trained doctor, just looking at a throat isn't enough to be sure. A virus and a bacterial infection can look almost identical, but their treatments couldn't be more different. That's why a test is absolutely essential.
The process is actually pretty straightforward. First, your doctor will evaluate your symptoms, looking for that classic combo: fever, sore throat, but no cough. Then, they'll do a rapid test with a quick throat swab, and you get the results in just a few minutes. Now, if that test is negative, especially in a child, they'll often send a second swab to a lab for a culture, just to be 100% sure. Since strep is bacterial, the treatment is antibiotics. It's really that simple. Penicillin is still the go-to, and you absolutely must take the full 10-day course. For the pain and fever, you can use standard over-the-counter meds like acetaminophen or ibuprofen to feel more comfortable while those antibiotics get to work.
Whew, we've covered a lot of ground, haven't we? Let's boil it all down and go over the most important things you need to remember.
All right, here's your cheat sheet. First, strep is bacterial, which means antibiotics are the answer and you have to finish the entire prescription. Second, it's contagious, so good hygiene is key. Third, that sore throat without a cough, that's your biggest clue. And finally, please always see a doctor. A test is the only way to know for sure, and getting it treated properly is crucial to prevent some really serious complications. So, I'll leave you with this question to think about. Now that you're armed with all this information, what key signs will you be looking for the next time you, or maybe someone in your family, gets that nasty sore throat?
I really hope this explainer has given you the clarity and confidence to better understand these infections. If you found this helpful, please do us a huge favor. Give it a like, share it with someone who might need to see it, and be sure to subscribe for more trusted medical explainers from MediByte. Thanks so much for watching.